Today, we're diving into a topic that affects millions worldwide: diabetes. It's a condition that's often misunderstood, but understanding it is the first step towards prevention and management. It's a condition that affects millions, but one you can influence. It's not just about sugar, it's about how your body uses the energy you get from food. Think of your body as a complex and finely tuned machine fueled by glucose, a simple type of sugar that comes from the food you eat, especially carbohydrates. Insulin, a hormone meticulously made by your pancreas, acts as the key, the master key to unlock your cells and let glucose inside, providing them with the energy they need to function properly. Diabetes happens when your body doesn't make enough insulin, or when the insulin it does produce isn't effective, or can't use it well, a condition known as insulin resistance. This leads to high blood sugar, also known as hyperglycemia, which, if unmanaged over time, can damage your heart and your entire cardiovascular system, kidneys, vital organs that filter waste from your blood, eyes, potentially leading to vision loss, and nerves, causing numbness and pain. When you eat carbs, whether it's bread, pasta, or fruit, your body diligently breaks them down into glucose, the fuel your cells crave, signaling insulin to step in and help move that glucose from your bloodstream into your cells, where it can be used for energy. In diabetes, this carefully orchestrated process breaks down, glucose builds up in your blood instead of efficiently fueling your cells, leading to a cascade of potential health problems. Genetics certainly play a role in determining your risk, but lifestyle is an incredibly powerful driver, often outweighing genetic predispositions, especially when it comes to type 2 diabetes, which is often referred to as lifestyle diabetes. Carrying extra weight, particularly around your abdomen, being inactive and leading a sedentary lifestyle, and consistently eating poorly, consuming processed foods and sugary drinks, can significantly contribute to insulin resistance, making your cells less responsive to insulin signal. Over time, your pancreas, working tirelessly to produce more and more insulin, can't keep up with the demand, and blood sugar rises, remaining elevated even after meals, eventually leading to a diagnosis of prediabetes or ultimately, type 2 diabetes. The good news? Many of these risk factors are within your control, meaning you have the power to make a difference. Understanding how your body works, how it processes glucose, and how insulin plays its crucial role, is the first and most important step to taking charge of your health and preventing or managing diabetes effectively. Your body sends warning signs when blood sugar is high. Don't ignore them. Constant thirst and frequent urination are early red flags. Unexplained weight loss can happen even if you're eating more. Fatigue sets in because your cells aren't getting energy. Blurred vision, slow healing cuts and tingling in your hands or feet are other signs. Recurring infections may also appear. These symptoms are your body's check engine light. If you notice them, see your doctor and get your blood sugar checked. Early action can make all the difference. Diabetes isn't just one disease, it's a complex spectrum of conditions that affect millions worldwide. It's crucial to understand that diabetes manifests differently in various individuals. It's a group of conditions with high blood sugar in common, but the reasons behind that high blood sugar can vary significantly. Each type has its own unique characteristics and requires a tailored approach to management. Type 1 is an autoimmune disease, a condition where the body's immune system mistakenly attacks its own healthy cells. In type 1 diabetes, the body destroys insulin-producing cells in the pancreas, usually starting in childhood or adolescence. This destruction leads to a severe lack of insulin. People with type 1 need daily insulin to survive, as their bodies are unable to produce this essential hormone on their own. Insulin injections or pump therapy become a lifelong necessity. Type 2 is much more common, accounting for the vast majority of diabetes cases worldwide. Type 2 starts with insulin resistance, a state where the body's cells don't respond properly to insulin. In this case, your body makes insulin but your cells ignore it, preventing glucose from entering and providing energy. Over time, the pancreas can't keep up with the increased demand for insulin, and blood sugar rises to unhealthy levels. Type 2 is strongly linked to lifestyle factors such as weight, diet, and physical activity. Making positive changes in these areas can significantly impact blood sugar control. Gestational diabetes develops during pregnancy, typically in the later stages. Gestational diabetes usually goes away after birth, as hormone levels return to normal. However, gestational diabetes is a warning sign for future risk of developing type 2 diabetes later in life for both the mother and the child. Managing gestational diabetes through diet, exercise, and sometimes medication is vital for both mother and baby's health during pregnancy. Knowing the specific type of diabetes is crucial because it helps guide treatment strategies and prevention efforts. Understanding these differences empowers you to take the right steps toward managing your health and preventing complications associated with diabetes. Receiving a diabetes diagnosis can feel overwhelming, but it's also a pivotal moment. It's a call to action, a chance to proactively manage your health and well-being. Here's how to take control and embark on a journey towards better health. Remember, you are not alone, and with the right strategies you can live a full and vibrant life. Monitor your blood sugar regularly. This is a cornerstone of diabetes management. Think of it as your health dashboard, providing essential insights into how your body is responding to food, activity, and medication. Keeping a log will help you identify patterns and make informed decisions. For type 2 diabetes, lifestyle changes are powerful medicine, often more effective than medication alone in the early stages. Eat balanced meals, focusing on whole, unprocessed foods. Fill your plate with a colorful array of non-starchy vegetables, lean proteins like chicken, fish, or tofu, and incorporate whole grains such as brown rice, quinoa, or oats. Be mindful of your carbohydrate intake, as carbs have the most direct impact on blood sugar levels. Spread your carb intake throughout the day to avoid spikes in blood sugar. Consider smaller, more frequent meals. Move your body. Physical activity is crucial for managing diabetes. Aim for brisk walks most days of the week, or choose activities you enjoy, whether it's swimming, dancing, or cycling. Exercise helps your cells use insulin more effectively, lowering blood sugar levels. Medication may be needed to help manage your blood sugar levels. Take it exactly as prescribed by your doctor. For type 1 diabetes, daily insulin is absolutely essential for survival. Think of diet, exercise, and medication, if prescribed, as the three legs of a sturdy stool, each playing a vital role. All three work together synergistically to keep you healthy and stable. Remember, small, consistent changes over time can make a big impact on your overall health and well-being. Prevention is powerful, especially for type 2 diabetes. Losing just 5–7% of your body weight can dramatically lower your risk. Focus on healthy, sustainable habits, not quick fixes. Fill your plate with fiber-rich foods and make water your go-to drink. Cut back on sugary drinks and processed foods. Move more. Aim for 150 minutes of moderate activity each week. Find activities you enjoy and make movement part of your routine. Regular checkups are key, especially if you have risk factors. Catching prediabetes early gives you a chance to turn things around. Invest in your health now for a better future.